Hi, hello friends. This is Dr.KARTHIKEYAN doing MD Medicine PAMC. So today we'll be continuing with our Let's Know Why series episode 4. Yeah, a 60-year-old grandpa came to the emergency with complaints of severe shortness of breath as well as cough with expectoration. And he also says that these episodes recur every time during winter seasons. The resident treating the grandpa was happy that he has almost found out the diagnosis. He gave him some bronchodilators, inhalers, as well as some injections. And to confirm his diagnosis, he also did a chest x-ray in which the lung fields were hyperinflated with a tubular heart. He became very happy. But after that, he also did an ECG for the patient. But in that ECG, he found this findings. He became suspicious that is there something dangerous going on with the grandpa? Yes, it's your job to crack what's going on in the grandpa, what kind of tachycardia, and what is the immediate treatment that should be given for this grandpa, and in this patient, what is the drug that should never be given. At the same time, in this patient, what can be given to control the rate if it is exceedingly high. At the same time, is there any role of radiofrequency ablation of AV node for this patient? If you find any difficulty in decoding tachyarrhythmias in an ECG, just check out my recent video on how to understand and then decode tachyarrhythmia, as well as I would have given a simple approach to approach a tachyarrhythmia in an ECG. Okay. If you like this video, like it, comment, share, and subscribe to our channel for future videos like this. The solution to this video will be discussed in our WhatsApp as well as Telegram groups. Thank you.